What up, guys? So I just had my 2-week follow-up and I saw the PA and the surgeon. So both of them were pretty excited at how everything turned out, and I got to talk to the surgeon a little bit at how everything looked when he was in there. But first, I'll go ahead and I'll take the shirt off and show you the incision, show you how everything's looking. Everything is healing up really nicely, so I'm pretty excited about that. Pro tip, if you ever do have a shoulder injury, it's one thing as a therapist I always recommend, get yourself a bunch of button-ups. It makes it significantly easier to get around, and plus, I mean, get yourself a nice little shirt like this, makes you feel a little bit happier, you know, when you're already going through it, something like this anyway. But let's pause for a second. All right, so here's my incision, if you can see, right? So it's collective about 8 centimeters. So for anybody looking, I mean, that's the size of my hand. So it's pretty good gnarly length. I don't really have a lot of swelling or anything, which has been pretty cool. Let me see if I can kind of show you from the side. You can see just a little bit how it's raised up a little bit, but overall healing really nicely. So I'll tell you a little bit about what he did. So this open, this is 8 centimeters here for reference, right? That's my, my hand. What happened was, so if we remember, there's 2 or 3, depending on what heads you want to talk about for the pec major. You have the clavicular head here, which is primarily seen with pressing overhead and such with like raising your arm up and like an incline bench. Then you have the bigger one, which is the sternal head here. Some people will divide the sternal head into the lower portion as the costal, being like your ribs, or the oblique head. And some people just call the whole thing the sternal head. Now, when it comes to this, I asked him today when I saw him how much of the head was actually torn off. He said it was well over 50% of the sternal head, but some of the fibers, the upper portion, were still intact, but only a small part was. Now, mind you, I'm roughly, I thought it was only 3.5, but it was actually close to 4 years after the original injury. So, no matter how I said this was 8 centimeters, well, it was measured, it was 10 centimeters in where the muscle had pulled to. So it was down here actually close to my nipple line. And he said when he actually opened it up, he had a hard time finding it. And he said that's really common, especially if there isn't a lot of tendon. But the only way he saw it was actually the muscles, the fiber orientation was actually in a different angle. And that's, what he was able to see. And he said there was actually a small stump, which is the tendon. Now, the cool thing about it, he was able to actually pull it all the way and stretch it to the bone. But when he wanted to try and, adhere it to the bone, actually achieve a direct primary repair, there wasn't enough substance to the tendon, right? There wasn't enough tissue to pull through. So if you imagine think of it kind of like dental floss and the sutures and such that they use. Well, when he was pulling on it, it was just ripping straight through the muscle, he said. So because of that, what he had to do is actually take a hamstring tendon graft. So he actually uses semitendinosus in the gracilis where they kind of meet together in the medial side of the knee and used that to graft. And what he did was weaved it through the muscle. That way it had something to pull on. So effectively was creating kind of like a tendon, a stump. That way he could pull on. Then, when he pulls on it, okay, he was able to pull that to the bone. Now, I actually have another porthole right over here, and what happened is, I asked him about it, and it was kind of what I was thinking. They use the retractors to really pull back the deltoid, okay? Because if you imagine where the bicep is, the biceps tendon, the pec is on the outside of that. And you have to really move the deltoid, right, the big shoulder muscle, you have to move that out of the way. Well, you don't want to just keep pulling and pulling and pulling. So it was easier, and he didn't have a good way to pull and make sure it was really sutured in really well. So he put it in, anchored it here, and then opened up the porthole back here. That way he could feed the sutures and then pull really nice and tight, get it exactly the way he wanted. And he said he was really happy with it. Now at this point, the suture for the direct repair to the bone, the tendon to the bone, is healed enough that I could theoretically start therapy, start moving around, start doing some stuff. However, because there's no substance, we need it to scar down. We need this new weave of tendon to scar down to the muscle to kind of create a new musculotendinous junction in order to have a great adherence long term. Now the cool news is, right, I'm gonna stay tied down in the sling. I'm gonna probably be in there for another 4 weeks, okay, for a total of about 6 weeks before I start moving. As a therapist, I'll probably start moving in a couple weeks, but lightly. But pulling in, the cool thing is, long term, it will actually be continuous. It should be theoretically like 98, 99%, just as strong as the original hardware, if you will. But it's kind of exciting, it's kind of cool seeing it. There is, you can kind of see a little bit of crusty, that glue. One thing they told me is the same thing that I usually will tell patients, such, don't wash off, don't pick at it, don't try to pull it off. It's gonna come off in time, let it. Key thing, if you're worried about the scar and you wanna focus on the cosmesis of it, number one thing, do not get direct sunlight, okay? As far as how long, probably 6 to 9 months. One thing you don't want to do, if you do get direct sunlight, it is going to turn this scar beet red or even purple. Okay, I don't really care about the scar at all. I'm like, the cosmetics of it, that doesn't faze me at all. However, one of the things that we want to do is, a lot of people know of like cocoa butter or vitamin E. That's great. You just want to make sure that it is fully enclosed before you start putting some of that stuff on. I talked to a buddy of mine who happens to be a plastic surgeon, and he mentioned do some silicone gel, so I went ahead and just picked some up on Amazon. And then I actually did get some strips that I can put over this, because I am going to be out in the sun a lot. I'm here in Tampa, Florida. We have nice weather, so I want to be outside a lot, and I don't want to make sure everything's always covered. But the second thing is, especially when that's healing, that first 6 to 9 months, you want to make sure that you have sunscreen on. By having sunscreen on, you're going to go ahead and protect that. And what that's going to do is that is going to allow that to heal better and turn white. At the end of the day, you're always going to have a scar. You can't have a surgery without a scar, but it'll be like white when it's fully healed. So that's ultimately what I want, because if the incision is healing well, that's just going to show me an indication how everything is healing underneath as well. But overall, I'm pretty happy. Little by little each day, I find that I can kind of open up my chest just a little bit more. Not really doing any like, crazy exercises. I am getting out of the sling a little bit throughout the day, just trying to do some computer work. After about 10 days or so, I kind of could get my left arm out far enough that I could actually type on my laptop and such, which has actually been a huge help. It's crazy kind of do it with one hand. But other than that, I have no pain. I'm sleeping into bed. After about 7 or 8 days, I was able to get back and sleep horizontal, which has been pretty good. But yeah, so far everything's healing really well. I'm at that point where I'm starting to get that itch to go back to the gym and push myself and do everything. But it's one of those things that waiting a couple extra weeks to protect it long term, make sure I don't have to restart this process, is more than worth waiting and do what I have to do in the meantime. So I'm trying to stay positive, trying to focus on things I can do, trying to get out, walk as much as I can, try to be as active as possible, and just try to do everything I can do to keep the healing and everything going in the right direction. But I'm super excited about that. As things come on, I will go ahead and keep you guys updated on the progress.